I hope you enjoy this review and find it helpful in your studies. You can get full ad-free access to the MedEd 101 Nursing Pharmacology Review course at meded101.com/nurse. MedEd 101's Nursing Pharmacology Review course is built to make meds finally click. You'll get nearly 20 hours of ad-free, on-demand video lessons, downloadable slides you can study from, over 40 cheat sheets and study guides, and practice questions to assess what you know. Whether you're preparing for exams or building real-world confidence, this course is designed by pharmacology experts for nurses. Stop memorizing, start understanding pharmacology at meded101.com/nurse. In this video, I'm going to cover routes of administration for medications. All right, so I've listed them all there. Sorry, it got a little bit small. There are some more rare ones too that I won't go into a ton of detail on, but I'll share those as well. But these are the most common that you're going to see in practice. All right, let's start with oral, often denoted as PO or by mouth. Oral ingestion, swallowing, is the most common medication route. It's easy, it's simple. Patients generally know how to do it, with exceptions, obviously. Very young and very old may have swallowing difficulties. We can have, powders, tablets, capsules, suspensions, solutions, syrups. These can all be taken orally, okay? Plenty of examples to go around here. Augmentin suspension, that being more of a liquid-type formulation, metoprolol, tartrate tablets, duloxetine capsules, and so on and so forth. So, again, most common dosage form. Absorption can occur as early as in the mouth. Most drugs, it takes that transition from the stomach into the small intestine. Small intestine is probably where you see most of it being absorbed. But depending upon the medication, you could get some absorption in the stomach and other places as well. Oral drugs will typically go through what's called first-pass metabolism. This is the breakdown of oral medications in the liver prior to getting into systemic circulation. So if a medication has a high first-pass metabolism, the percent of that medication absorbed is probably going to be lower. Okay? With oral dosage forms, some of the advantages I alluded to: convenient, self-administration, safe, inexpensive. We're not worrying about getting an infection because we're injecting something into the, skin or muscle. Again, young, old, patients that are unconscious, experiencing a seizure, intubated patients. These are all examples of patients that obviously would not benefit from an oral dosage forms, be able to take, or safely be able to take as well. Because of the convenience and the potential advantages of pills and taking medications orally, you might think to yourself, why don't we give all medications? Great example. Why don't we give insulin orally? Well, some medications are larger type of molecules, or they are quickly broken down by stomach acid and other enzymes, and you don't get adequate concentrations into the blood. And so insulin's a great example of that. It can't be administered orally due to that gastric acid destruction of the molecule. And obviously it won't be absorbed, and if it's not absorbed into systemic circulation, it's not going to work. So, this is why we need alternative dosage forms, like with insulins. That's why we give it sub-Q. All right, a couple others. These are considered, oral dosage forms, oral routes of administration. So buccal is in the cheek, or I guess kind of a one-off of oral administration. Buccal is leaving that medication in the cheek. Sublingual is under the tongue, often denoted as buccal is BUC. You may see that in instructions. SL is sublingual. I don't love these abbreviations. They could certainly be interpreted as other things, but it is important, I think, to know them as a healthcare professional. So buccal is going to enter that bloodstream via crossing the oral mucosa tissue in the cheek there. We avoid first-pass metabolism, so we may have some better bioavailability there. Some potential candidates for buccal administration, if we want a little more rapid onset, if you're having trouble maybe with compliance or adherence, or maybe difficulty in swallowing certain types of medications there as well. Now, potentially poor candidates for buccal administration, obviously, anything oral or surrounding the mouth in unconscious patients, we're unlikely to use that. Nauseated, patients experiencing difficulty swallowing, these are candidates that, might basically want to spit out that buccal dosage forms there. Nicotine gum is a good example. Patients chew it a tiny bit, and then they stick it in their cheek, and they get that nicotine absorption. Sublingual, again, drug placed under the tongue. You may see, in addition to SL, you may see ODT, so that stands for oral disintegrating tablet. That can be another, notification or another abbreviation, I should say, that can be utilized. This is going to, again, kind of similar to buccal. The only difference is it's under the tongue. Again, similar relation with first pass effect in that we generally avoid that. Nitroglycerin tablets, that's probably the most common. Okay, so if you got that patient with chest pain, sublingual nitro tablets, definitely one of the more common dosage forms there. Parenteral, so we've got sub-Q, intramuscular, intravenous. So basically these are drugs that are injected. These will essentially provide 100% bioavailability or very close to it. And this may depend upon the administration area a little bit. Subcutaneous, so this is injecting into the layer of skin below the dermis and epidermis. Abbreviated SC or sub-Q. Insulin, heparin, two great examples there. IM, so this is a little bit deeper injection into the skin. Well, through the skin, I guess, into the muscle. Abbreviated by IM. Many of the vaccines are IM administration. Intravenous, injection directly into the bloodstream. Typically, this is going to be done in a healthcare type of situation, type of setting. Abbreviation is IV. Obviously, we've got plenty of fluids and antibiotics and other medications that can be delivered via IV. Obviously, disadvantages, higher cost. We've generally got to administer some of these things in a hospital type setting, maybe particularly more so with, IM and IV. Sub-Q, we obviously do insulin and stuff at home, or patients can when educated. But again, we've got the disadvantages of doing an injection. Most patients do not like doing injections if they do not have to. Now, advantages, we're generally going to get really good bioavailability. We're going to have pretty quick onset for the most part, and easier ability to kind of, titrate, change the dose, those type of things sometimes. And we're going to be able to see that response a lot quicker because of that rapid onset. These I'm just going to leave here for you. It's pretty rare that you see these utilized, intrathecal potentially in pregnancy, labor, and delivery, those type of things. And then the others are maybe a little bit more specialty, but maybe a good review in medical terminology there for you. All right, topical. So these are used generally for localized effects. Great example is clotrimazole cream. It's an antifungal type cream. That drug is going to be absorbed through the skin and distributed through the skin tissue. Generally going to be metabolized in the skin and then circulates systemically. Now, most creams, of lower percentage, lower drug content, the systemic absorption is probably not going to be significant. Again, I'm talking about small areas of application. Now, if you get a medication that is significantly absorbed through the skin and we use it on large areas, okay, well then you could maybe run into some systemic absorption and some systemic adverse effects, so pay attention to that. Advantages, self-controlled patients can pretty easily do it. It's not that big a deal, right, to just rub a little skin. It's not invasive. It's not like an injection. And generally we avoid first-pass metabolism, but usually we're using localized effects here for most topical type applications. Disadvantages, I would say, probably the biggest thing patients complain about is, particularly if it's like an ointment or something, it can get really greasy and slimy and those type of things. But otherwise, pretty easy for patients to administer and usually not too much of a big deal. Rectal and vaginal administration. So rectal administration does bypass first-pass metabolism, at least to a significant amount, maybe not, as much as IV or something like that, but we do bypass that a little bit. Advantages of rectal administration, we can treat something like ulcerative colitis, which is mostly confined to the end of the GI tract and the rectum. So that's an advantage there. If we've got unconscious, intubated patients, rectal administration can be advantageous if we don't want to do, injection or something, or don't have that capacity for some reason. Disadvantages, uncomfortable, patients might feel a little bit embarrassed about it. Absorption can be a little bit erratic. We may get some irritation to the rectum there as well. There's, ointments, suppositories, enemas. There's definitely different dosage forms that can be given rectally. Vaginal administration typically does avoid the majority of first-pass metabolism, so that's nice. Advantageous in that we can have that localized effect, and we don't have to take a medication systemically and worry about significant systemic adverse effects. Again, similar in an unconscious intubated patient, it can be utilized there. Disadvantages, obviously, complicated to administer, maybe uncomfortable for some patients for sure. Depending upon the drug, depending upon how we administer it, we may get some systemic effects. So again, kind of depends upon the drug, depends upon the dose, those type of things. Gels, creams, enemas, these can all be utilized via the vaginal route. Transdermal drug is delivered throughout the entire body or systemically through the skin absorption via a patch, fentanyl patch, scopolamine patch, Vivel dot, so that's a estrogen type product. Absorption and metabolized by the skin, distributed systemically. So again, getting it into that systemic circulation. Candidates that would benefit from transdermal administration, well, obviously, patients who have difficulty doing oral administration also can give you a nice, consistent drug delivery. So with fentanyl patches, we can kind of continuously give opioids. I'm not a huge fentanyl patch advocate for other reasons, and I'll probably get into that in the pain section, but it does give you a continuous delivery of the medication. Patients who are having issues with their GI tract, maybe they had a GI surgery, for example, utilizing transdermal delivery may be advantageous there. Poor candidates, if you got patients that are, really sensitive skin, dermatitis, they have significant, allergies or intolerances to different tapes and adhesives and things like that, that's obviously a big negative with regard to transdermal administration. Very, very important with transdermal administration. Big negative to it. Generally, we don't have very quick absorption via transdermal route. So if you're treating acute nausea, it's probably going to take a while for that drug to get into systemic circulation and start bringing any relief. Okay, So that's an important thing to note. You're not going to get acute relief with the use of transdermal administration typically. Intranasal solutions, sprays, inhalants that are basically sucked up through the nose and administered that way. It's generally it's generally absorbed into venous circulation. Narcan's a great example there, where it, pretty quick onset to treat an opioid overdose type situation. And then, fluticasone nasal spray is a very common one used for allergic rhinitis. It does bypass the blood-brain barrier as well as first-pass metabolism, so that's nice. Very rapid delivery, rapid onset in most situations. So that's why naloxone or Narcan is effective. Disadvantages, maybe uncomfortable, irritating. Young children really might not like that, as well as maybe patients, elderly patients with dementia and stuff, where you can't, explain, or they may not understand, what you're trying to do. Inhalation. So this is atomized drug or fine powders that are administered through the windpipe. So basically breathing them in. Plenty of examples there in the asthma COPD section. You got your Advair, your Ventolin, so on and so forth. So inhaling medications into that respiratory tract. We generally don't get a lot of systemic absorption, so that's great because we don't want to, particularly when it comes to corticosteroids. Localized effect can be good, advantageous, and again, trying to avoid that systemic adverse effects. Disadvantages requires hand-mouth coordination, which can be a challenge for some patients for sure. And then we've got eye administration as well as ear administration. Most commonly, ophthalmic administration. We're going to be, on a chronic basis, probably treating something like glaucoma. Advantages here, utilizing that medication locally. We just want to treat the eye. We don't want to have to take an oral pill and have systemic adverse effects and things like that. Eye drops can be very difficult to administer. Some people struggle with blinking and getting it in there. Sometimes we can, maybe get some variable dosages. So if, patient accidentally squeezes too hard and we get a couple of drops, or we get an oversized drop, getting exact dosages there may be challenging. Administration into the ear, similar disadvantage where that administration can be very difficult there. We can treat, localized acute ear infection, and those type of things with otic administration. Acetic acid solution, we may utilize medications for removing earwax and those type of things. Again, trying to utilize the localized effect for ear administration or otic administration. Struggling with nursing pharmacology? Would you like a resource you can put in your hands? You're not alone. If you want to understand medications instead of just memorizing them, check out the MedEd 101 Guide to Nursing Pharmacology on Amazon. Written by a board-certified clinical pharmacist, this book breaks down high-yield drug concepts, clinical pearls, and real-world examples that actually stick. Perfect for exams and the bedside. Whether you're in nursing school or already practicing, this guide helps you build confidence with medications fast. You can find a direct link to the 233-page book right now at meded101.com/nurse. That's meded101.com/nurse.